Well, hi, Chris. Want to thank you so much for agreeing to jump on and explain some of the new science and the new findings on some ingredients that can help with cognitive function, with memory. Getting a lot of questions from people, not just seniors, but even people down into college days. People are working at home and the kids are running around and they're having memory issues. And what's real exciting, there seems to be a lot of research going into some very basic, simple, um, natural products or ingredients that can be
Mhm.
very helpful for memory. And you're the one to go to, so that's why we brought you on. So I'm going to mute myself and turn this over to you.
Thanks, Gary. I appreciate it. It's been great working with you over the last 15 years. I appreciate you having me on to talk about these new exciting ingredients, clinically studied ingredients that are natural solutions for both cognitive and mood support. The key is they help with both working and recall memory, mental focus and concentration, and also another benefit that you usually don't see in some of these concentration brain fog formulas is that it helps with mood as well. So saffron is one of those ingredients. So I'll talk about those three key ingredients and we'll kind of start out. These are the three ingredients. They're non-stimulating, which is important because you have a lot of patients that are on high blood pressure medications, and that they might have issues if they take stimulants with falling asleep at night. The modern clinically studied effect is these are recent studies on these three ingredients. I'll go through each one, starting with Pneumantix. So Pneumantix is a spearmint extract based on four capsules. It's not 900 milligrams is the clinically studied dose. It's a unique combination of polyphenols. So the the mechanism of action, or should we say the how it works, is that these phenolic compounds protect the brain from oxidative stress and inflammation. We always hear about the effect of inflammation on the body. Well, especially on the brain, it can affect memory, and it can affect long-term problems with you know all kinds of brain diseases, Parkinson's and such. Um, Also, dementia, all kinds of different brain issues. There are three big studies that we use to kind of, really focus on this product. We'll focus on two of those. These are nootropics, they're called, which are protective. They protect the brain tissue and neural membranes from oxidative stress and inflammation, like I mentioned. So Pneumantix is a spearmint extract. It is, they don't use heat in the extraction process, so it keeps it 6 times more bioavailable than most forms of spearmint, which is going to make it more effective than just say your spearmint that you hear about in cooking or culinary or in spearmint gum. This is a more potent, concentrated form of spearmint. These are the two studies I wanted to talk about today. The first one is with men and women. It's at the top. It's with men and women. Uh, they're older. They have age-associated memory impairment issues. Um, and the study was over 90 days. It's 90 subjects. One of the great things with Pneumantix experiment is you don't need 90 days to feel the product. It tends to work right away. So 90 days is more or less just to confirm that it works for a long duration, but it does work fairly quick. 15% improvement. This is with working memory. So working memory, another name for working memory is multitasking. So all of us right now, we're multitasking at home. Our kids are at home as well. We might be working from home. We're doing multiple things more than usual. So this is going to be definitely something to consider. Down the bottom, improvements with sustained focus. So with 90 days, once again, More subjects, 142, but this is for sustaining attention over a long duration. So think about, you have a long day at the office, you wake up, or at home, at your home office, you wake up and you start working at 8, things happen, you're working, helping your kids out, you're doing your job. By the time you realize it, it's 4 o'clock in the afternoon, 5 o'clock in the afternoon, you're exhausted, you can't think. This might be a way to offset that decline in memory and focus. The second key ingredient that I wanted to talk about is called cognizant. It's acetylcholine, and clinically studied at 500 milligrams. It shows some great effect with a wide array of ages, and both male and female. And we'll get into the structural and functional effect that it has on the brain. So you can feel, once again, a pretty immediate effect with memory and attention being affected. And we'll get into 3 studies with cognizant. The first shows a 21% decrease. This is at the top. Once again, it's the older patients being clinically studied for improving memory performance. And it's over 28 days. They showed a 21% decrease in delayed object recall. So omissions, mistakes, less mistakes basically is what occurred. 21% less mistakes. And this was, and at the bottom is a pretty dramatic clinical study that was done on kids, adolescent males ages 13 to 18, and it showed improved motor speed of 345% improvement, which is dramatic. This, once again, is a 28-day study, and a visual attention increase of 40%. So both pretty dramatic numbers, but think about how a lot of kids are homeschooled. Their visual attention kind of wanders. Motor speed can dull over a long day. This might be something that brings them back into focus, allows them to concentrate on their studies while they're home, or if they're going back and forth like they are in my town, doing both at home and at school, it'll allow them to stay focused. This could also help their parents. So their parents, helping them out, helping them with studies and things like that. I have younger children, so I'm the teacher essentially, and I'm going to need more focus and attention to help them out. So this could help both parent and student. A recent study is so recent, it's June 2020, and episodic memory was affected over 12 weeks. 99 subjects using cognizant acetylcholine, 500 milligrams, and it helped with episodic memory. I'm going to check my notes because it's such a new study. I'm going to make sure you get all the details. This is with patients that don't have dementia currently, but are cognitive declining, and they can take it safely as a preventative. It can help with details of past events. Also composite memory, which is, those tests that we did in college or high school where you're trying to put shapes in certain places and then remembering where they went. So this was over 12 weeks, an improvement, overall improvement, especially with episodic memory. So, things that happen in your life and being able to remember details. And this is a pretty cool study for anybody that's just looking to improve. The third key ingredient, when you talk about brain fog and you talk about attention and focus, oftentimes when people suffer with those issues, health issues, they are depressed and they get upset. They have mood issues because they're frustrated. Well, saffron could be a great complement to those issues to get people back on track quickly. 30 milligrams is the dose that's recommended. It does three things. If you want to think about it, it's used in culinary also. So a lot of my practitioners that recommend saffron. They've used it in the past for culinary, but they didn't know necessarily the benefits that saffron also has for mood. So it's a natural way to help with a patient that is depressed and they might not want to use SSRIs. They might not want the side effects, weight gain, or low libido that can come with SSRIs. So saffron could be a good option to start with. It's been studied in comparison to antidepressants, so head to head with two popular antidepressants. I'll get into detail on those in the next slides. As an add-on therapy, so you can use it along with antidepressants, or as a monotherapy. It's been studied versus placebo, which is important because it's outperformed placebo, which shows it has that true effect. These are the studies that we want to kind of pinpoint. Saffron, there's a 40 subject study over 6 weeks, and that was with Prozac head to head. It showed that it was effective. Saffron at 30 milligrams was effective head to head as equal to Prozac, which is great. And the second study we'd like to zoom in on is a head to head versus Celexa. So that's just a clinical name for Celexa. And once again, this was a study for major depressive disorder and anxiety. So they used the Hamilton rating scale for depression, and it showed that there was no significant difference between the results of saffron and Celexa, which is great. So you can see two commonly used SSRIs that saffron's performed equal to. So that's the three ingredients I kind of wanted to focus on with you, Gary, and talk about and give you all that information. I know the folks at Johnson Compounding are aware of these ingredients, and I wanted to pass it back to you.
Okay, well, thank you. And I liked your point about the homeschooling. It's not just the high school kids or the college kids at home, it's the parents also. Everyone's being stressed. You know, it's great working from home, but, you know, there's pluses and minuses to this whole social distancing. And what I find exciting is there's now clinical studies on these ingredients, and they show that they do help, whether it be a senior with beginning of Alzheimer's, or just people who are just overly stressed, overly working, trying to juggle too many things. It can be helpful. And looking at the ingredients, there's nothing that isn't supportive of the body in there. So it looks like just helping the body do what it's trying to do, which is the ideal way to help yourself. So, Chris, I want to thank you so much for jumping on. This is great information, and I hope to see you soon.
Thanks again, Gary, for having me on, and I hope these ingredients help benefit a lot of patients out there and people that may be suffering with brain fog and mood issues.
Well, thank you. As people are using them, I'll give you some updates. Have a great day.
You too. Thanks, Gary. Take
Bye-bye.
care. Bye-bye.